Good morning, everyone. Welcome. My name is Joan Buttorff. I'm a professor in the School of Nursing here at the University of British Columbia at Okanagan. And I'm really delighted to be able to co-host this session with you this morning. But before we begin, I want to respectfully acknowledge that UBC Okanagan is situated on the traditional, ancestral, and unceded territory of the Silk Okanagan Nation. And I also want to acknowledge that you might be joining us today from many places, near and far. And I want to take a moment to acknowledge the traditional owners and caretakers of those lands as well. So before we begin, just a couple of housekeeping things. You might notice some closed captioning on your screen, and that closed captioning box can be moved to your preferred place by clicking and dragging it, or you can turn it off using the live transcript button on the menu bar. There's going to be lots of opportunity both throughout the session, but also after the talk to type in questions and comments, and we welcome those into the chat box at any time. And we will read them out to our speaker and invite responses and further discussion. So today's event is a visiting scholar webinar presentation by the Institute for Healthy Living and Chronic Disease Prevention. And we're co-hosting that with the UBC Okanagan Campus Wellness and Education. So before we get started, I want to introduce Melissa Feddersen, who's director of the UBC Okanagan Campus Wellness and Education, to introduce our speaker. Melissa.
Thank you, Joan, so much for hosting today and welcoming us to partner with you. Very excited to have Julia join us on campus today and in person. We've just met though 15 minutes ago, but our paths have started to cross through our Healthy Campus international work and through the symposium related to the International Health Promoting Universities Network. And so very pleased to have Julia and to hear about her research. Julia is in an Economics and Social Research Council funded PhD candidate with King's College in London, who is doing an overseas institutional visit with us here. Her research is exploring the barriers to university peer support for student mental health and well-being. Julia also runs a student-led well-being service at King's that includes peer support. So she has both a practical and a research view. And she's coming to visit us for an international perspective of peer support. And so she's done a little bit of visit in Vancouver. She's visited our colleagues at some of the Foundry sites. And now she's going to spend a little bit of time with us on the Okanagan campus. So Julia, we're so pleased you're with us and really looking forward to hearing about your research and practice.
Thanks so much, Melissa, and a huge shout out to everyone who has supported in this overseas institutional visit. I'm kind of coming to the end of it in the Okanagan right now, and it's been such an incredible experience. So thank you so much if you've helped me organize it and getting here. Melissa in particular, as I can see your face right now. But thanks to everyone. It's been a really incredible opportunity. So it's such an honor to be here, and I really appreciate you starting your day. Or if you're in Canada, I know some people might be calling in from the UK, so it's later on in the day, but I really appreciate you starting the day here. And I'm really excited to talk to you about some of my research that I've been doing, really some of the thinking that I'm doing around university peer support. So this peer support for university mental health, can non-professional interventions improve mental health and well-being? It was originally the title of my PhD, and I'm going to talk a little bit about how that's changed and where we are today. But firstly, who am I? I think that Melissa's given a really overarching view of my backgrounds. But yeah, I come from kind of multiple backgrounds, and I suppose there's a lot of people have been expecting a different accent when they hear that I am coming from the UK. So I'm originally from Wisconsin in the States, but I've lived in the UK for 9 years. Accent hasn't broke. I have not switched over, not by choice. It's just not my vibe. I can't switch accents, as it turns out. It's not my gift. But feel free to tweet me, connect with me on LinkedIn. It would be great to connect outside of this webinar. My details are on this slide, and I'm sure we'll be sharing the slides afterwards. But yeah, really my interest in peer support came from running a peer health education program in Wisconsin, both as a student supervisor and then as a professional staff as well. And that has really kind of changed the trajectory of my life at university, thinking that I was going to go into medicine. And then I got involved in some health education work. And I was like, hold on, like prevention is really, that is incredible. And I was so excited about it. And it really changed the trajectory of things for me. So when I talk to university students, I always say, you know, try lots of different things because you never know what's going to happen at university. An experience that you might have at university might really kind of give you the direction of what you want to do and something you maybe didn't even know existed. But anyways, let's talk about my research a little bit. So what we're going to cover today is 3 areas. So we're going to kind of briefly talk about why university students are a population of interest, what's going on in the UK when it comes to policy and university student mental health in particular, because there's been a lot of kind of progression in that area. And then I'm going to talk you through kind of where my research is and an overview of the study. Bear in mind that I am a little over a year into a 3-year PhD. So a lot of my kind of findings are very initial findings. So, you know, I'm giving you a taster in hopes that you'll follow my journey in this PhD and be able to share more conclusive findings later on. But yeah, so why the focus on what we would call uni students in the UK? University is too long of a term apparently to use, so uni is the term. So there's a lot of reasons to focus on university students. You know, in practically speaking, university is a time when potentially you're gaining your first independence and making a lot of decisions for yourself when it comes to health behavior. That was always why I was attracted to supporting university students from the start. But in the UK, we have a real growing number of young people who are going to university. This is like high participation rate in higher education in the UK, about 50%, and that's going up. And 2/3 of students who are in higher education are under the age of 25. And why does that matter? What is that age? So why is that age so special? I mean, any of you who work in mental health will know that kind of that emerging adulthood age is really significant in kind of, it's actually a theoretically and empirically kind of distinct time of life, and it's a huge structural brain development from 8 to 30. And ultimately the big thing and the big discussion is that 75% of sort of the onset of mental health difficulties that there are going to form tend to happen before the age of 24. And a large proportion of them are even before the age of 14. So we know that that is kind of a statistically vulnerable time in people's lives. That tends to be the time you go to university. And if there is going to be a mental health difficulty that develops, university could be the time because of the age that you're going. So that's kind of why university students are a group and a population that we want to keep an eye on and want to potentially provide extra support for, especially when they're learning to navigate potentially their mental health journey. Maybe it's newly emerged at university, or maybe it's something they're learning to kind of manage on their own independently outside of whatever home they've grown up in. So that's why we're interested in university students. But the other thing that I think is really important to highlight is that students often tell me, I was told that university was supposed to be the best years of my life. And this is very different than that. Is this hard? And I think that that is the reality. There are a lot of challenges at university. There's lots of ups and downs in the experience. So I don't, if you want to put in the chat, you can just choose everyone, I think, in the chat. It looks like it kind of goes directly to hosts and panelists as a start. If you choose everyone, I think you can share. What kind of challenges do you think university brings that could contribute to students experiencing difficulties? So aside from that sort of vulnerable age, think a little bit about what other things are happening at university. So kind of things, and you can put them in the chat if you'd like to. Things that come to mind immediately are really, you know, potentially new gained independence, or even if you're still living at home, like navigating that, because sometimes that's the expectation is that people are living on campus and they have this new independence, but maybe you're living at home, so you're having a really different experience. And ultimately you're learning so much about yourself. And there's some really other good ones going in the chat, like self-identity, like kind of understanding who you are, building your own self-efficacy, self-awareness, financial stress. Yeah, like in the UK, fees have been like recently introduced, as in like in the last like 20 years, I think. And so there is a lot of added stress in that. And in North America, of course, like this has been a kind of a capitalistic society that we've lived in, and the cost of going to university is a big one. And I think young people today are thinking about, is the cost worth what I'll get at the end? Because the job market is a little bit crazy. It's just an added stress. Lots more students, like anecdotally, are talking about their careers, like what's their professional outlook look like than I remember when I was in university, even, which was a few years ago. Loneliness. Yeah, loneliness is a massive issue that loads of young people are facing. And coming to university in COVID definitely highlighted that. And I think it was an issue before COVID, though. I just don't think it was as much in the discussion. Different expectations. Yeah, like the academic rigor of university could be potentially way different than what you did in school. I went to a really small town high school, and I got to say, it wasn't like the best. I went to a big university to start in the Midwest. And I remember going to lectures, and other students around me had better kind of high school experiences. They were like, oh, this is just a review for me. I was like, this is totally new information for me. Like, I didn't have that kind of academic rigor in my high school. Making new friends is like one of the number one concerns when university students start. And it kind of, yeah, it's such an important thing of like, who are your people? Where do you belong? Like, how do you kind of get set up? And just like starting from scratch in that way, it's a really tricky time. Living away from home, yep, definitely lots of international students. I said loneliness as well, learning how to care for your own health and wellness. Yeah, like navigating different health systems. Maybe it's like dental care, health insurance. Maybe you've never had to think about that before. And as a note, Jaquetta just added, just please choose everyone to include all guests here today. There's to everyone that you can choose in the chat. And if you don't have that option, I think Jaquetta's looking at it. The other one that's been added, which is really good, is kind of this sudden need to be personally responsible, and suddenly you're like held accountable. It's like, boom, you go to university, and it's like, well, you're an adult now. And it's like, I mean, gosh, I've been working in higher education for a decade now, and I'm looking at these incoming students, and I was like, you seem really young. Like, are you sure you're old enough to be here? And I'm not sure if that's just me getting older, but anyways, thank you so much for sharing that. And I think I was able to share everyone's that they've contributed, even though maybe you can't see it. So thank you so much for that. And I think you should be able to choose everyone now for other chats. But I think the big story is like, this is a vulnerable time statistically in people's lives for developing a mental health difficulty. And going to university has a lot of ups and downs, and it's a real like different like wave of a journey. Like sometimes things are really going well, and sometimes there's loads of challenges, let alone the academic challenges, of going to university. So that's why university students are a population of interest. There's quite a lot of added stress that comes with going to university, in addition to the age that most people are when they go. So the other thing that I just want to highlight, and I won't go into too much detail about it because you may or may not be interested in UK policy, but we have a new university mental health charter that we're quite proud of in the UK, and I think it's really impressive what they've done in developing this. And so I just want to share it briefly so you kind of get a sense of what the context and landscape is in the UK. So ultimately, as most universities are experiencing, there's been a real increase in the need for support services from university students. There's been an increase I've seen in the complexity of mental health difficulties that students are facing. There's just greater need for support. And most universities are struggling to meet that demand, and especially with staffing shortages and all these different things that have come out of COVID. But even before that, we were struggling. And so there's a real conversation about what else can we do other than just sending university students to counseling services when they're having a tough time. And so one area that I'm really excited about, and it's kind of the baseline of my PhD project, is thinking about universities as health settings. So the World Health Organization kind of has a health setting as a place or social context in which people engage in daily activities or environmental, organizational, and personal factors interact to affect health and well-being. I think from that definition alone, you can kind of agree that universities really are health settings, and they are kind of there's a full spectrum of positive and negative effects on all students from the environments that we're in. And I kind of like to think of it as well as like university isn't some vacuum where you come get a degree and leave, right? Like we all affect each other. And we are all living in this community and creating this community where we're impacting the mental health and well-being of the people in our community. And so really this kind of whole university approach and understanding that universities are kind of determined by complex individual, interpersonal, community, environmental, structural factors. We live in community, and actually we are impacting each other in that. And so viewing universities as health settings kind of opens up some doors and thinking about other ways that we can support student mental health. So some progress that has happened that, I mean, one of them's named after the Okanagan region we're in. So is really thinking about universities and considering this health settings approach to really consider how we can take a whole university approach. So that really recognizes that we are all part of this and the environment that we're in is playing a part in our mental health and well-being. And so the Okanagan Charter was really groundbreaking, and I won't go into that because you will know about the Okanagan Charter and that international charter for health promoting universities. I remember when I first discovered the Okanagan Charter, I was like so excited because I come from a health promotion background originally, and I was just like, yes, like social determinants, like thinking through this in a really settings approach, I was really excited about. And in the UK, I think it started and I think it was originally released in 2017 that we have a step change mentally healthy Universities UK. Universities UK is a body that kind of supports leadership across universities in the UK. And they kind of will set policies that is like supported to go into different institutions. But the step change framework was really kind of built off the Okanagan Charter and thinking about how we create this whole university approach. But it was pretty open what it was. I don't know if it was practical. It's enough. It has been updated, and I think it is better than the first one. But the thing that I think really excites me is been built off of both of those things, and that's the University Mental Health Charter. So Student Minds is the UK's student mental health charity. They're a tiny charity that has a crazy amount of reach, and actually my PhD is in collaboration with this charity. So they talk to thousands of students and staff across the country and asked, what does a mentally healthy university community look like? What does that actually mean? And from that, they've created this charter that has 4 different areas of focus and has really practical things related to all of those from that research. It's such an exciting piece of work. Lots of institutions have really bought into it and are working towards getting that charter mark, because I think it offers a lot of practical guidance about what this actually looks like. Because we talk about this whole university approach, how we all impact each other. But the reality of how to actually do that is a challenge, right? But I think the piece that has been exciting for me in the University Mental Health Charter is my area has been peer support, because we see that university students are making an impact on each other. And so actually recognizing that they can lead on creating a healthy community is an important aspect to consider, because if you don't recognize that students are building that, you're kind of missing this whole opportunity. So peer support has been the way that I've gone about that, and training up students to support other students and really equipping and empowering them to do that through a variety of ways. And what I was excited about in the charter is that peer support is actually one of the enabling themes in the University Mental Health Charter. And so that charter is recognizing that actually students supporting each other, we see that as part of a whole university approach, and we see that as good practice for institutions. And so that's kind of like why we focus on university students. And that's the context in the UK. Lots of institutions are getting really excited about the University Mental Health Charter. Our MP for our Minister for Universities is really pushing institutions to apply for the charter within 5 years. And yeah, it's an exciting piece of work. And it looks like Melissa shared some information about what's going on in Canada as well. But I think it's a helpful document to share. So I think that's been shared in the chat as well. So where does this fit into my research? So I think the charter was published, I think in 2019. And so I was really excited to see peer support as part of that. I wasn't really planning to do a PhD. I didn't really go searching for it, to be honest. But PhD came up, that was like the question I've been asking myself, which is, where does this fit into a whole university approach, and how can peer support actually really support institutions to support students better, to create like different layers of support and to equip and empower students to build healthy communities, really. And so at King's, we have recognized peer support in our mental health and well-being strategy. And so this was originally released in 2018, I believe. And so that strategy is really, we use this pyramid of support model. And so ultimately what that means is that we recognize that all of these things are impacting student mental health and well-being. And so the curriculum is the very basis. So most students, other than PhD students who might not have a set curriculum, are being impacted by the curriculum at King's. And so we actually have published in partnership with some other institutions in the UK an Education for Mental Health toolkit to support academics to think about, how does your curriculum actually impact the mental health and well-being of your students? And what can you do to create psychologically safe environments for students to learn and grow? But this pyramid model came before that toolkit, the Education for Mental Health toolkit, and I can send the link for that if you're interested in that. But this pyramid model is recognizing that that thing is impacting students, and ultimately this is the whole university approach again, like all of these things have an impact. And so let's recognize that and think about how we can improve those along the kind of journey of students' mental health. So on the bottom is student self-knowledge, self-care, self-regulation. So we recognize that actually the self-awareness piece is really important for students, and giving them some resources to learn how to look after themselves and recognize when they need help. So I oversee an online well-being hub that has different resources that were co-created by students. So that's one piece, how we kind of do that. There's lots of other ways we do that. And so as you move up the model, like fewer and fewer students should be accessing these different types of support, but the curriculum is obviously the thing that's for all students. So we also on level 2 recognize that this informal and student-led support, which many types of peer support really fit into that, are also having an impact. So once again, this is kind of like, as on a strategic level, helping me to see where peer support fits in a university setting. We also have pastoral support services. So these are kind of a little bit more formal services. Actually, some higher levels of peer support can be kind of meet that sort of definition of a pastoral support service. And then we have our university specialist services and external support services. So this is our pyramid of support, and I can't help but do this every time I talk about it, but really I think it helps for us to see that whole university approach in a model. And it also helps when we're talking about services to understand where they fit in. So it's like, are we really top heavy? Are we really like just like putting loads of resource into the external specialist services, or like what can we be doing on the bottom to support more students and think about that kind of step care piece. So that's the pyramid model that at King's we use and we developed, and it is definitely, we're renewing our strategy, our mental health and well-being strategy at King's in alignment with the mental health charter, because we'll be moving towards the charter mark. But this pyramid model it might change and evolve a little bit to include staff, because I think that's the important part of the university mental health charter, is it is an inclusion of staff and students, and to recognize that we are all part of this community. And I think that's where our strategy probably didn't quite meet the standard last time, because it was really focused on students. But at King's, we're trying to pull that together. And so we will be using this pyramid model because I think it's a really helpful model to talk about strategy. But that's the context in the UK. That's why university students. And so I'm going to talk a little bit more about this PhD of mine, that little thing. So yeah, originally we wanted to focus on if university peer support can, as a non-professional intervention, improve student mental health and well-being. And so that was the original idea. And I'm going to talk about where that has been. So the idea with this is that there's not a lot of exhaustive research reviewing kind of peer support interventions evaluated in university settings. So there's some peer-run community mental health programs that show really significant reductions in depressive symptoms, performing as well as professional-led interventions, and significantly better than no treatment to conditions. But this hasn't been replicated properly in university settings. And university settings are quite unique. I think we've sort of established that. One of my supervisors, Dr. Nicola Byram, did a a research project kind of looking at group support for depressive symptoms and found some improvements, but they didn't have a control group to really say if that was the thing that had made the difference. So the goal of this project was originally to measure the efficacy of a group peer support for students experiencing low mood or mild depression. But the tricky part is defining peer support and actually having students come through the door. So things have changed a little bit, and I'll talk through that, where the focus is actually going to be now. But the other tricky part about these different peer support programs is that the evaluation and engagement is really disparate, making it kind of quite difficult to understand how this affects mental health and well-being. And so that's where things get to be a little bit tricky, is it's very difficult to compare programs when they all operate so differently. So what this project has kind of become is really understanding what peer support is. So I have just launched into this, and I have said peer support a number of times in this presentation thus far, and I've totally not defined it, right? And that is a common issue I see in this world, is lots of institutions are interested in how peer support could be added as an additional support for students. It could be added in as kind of a health settings approach, taking that whole university approach. That all sounds good. But ultimately, there is very rarely a definition of what a peer is. What do you mean by peer? What does that actually mean? What does the program look like? And are they comparable? So what I have started with is trying to understand what current practice exists in university peer support for student mental health and well-being. And I have 3 different studies that I'm going to go through that are kind of working towards understanding that question: a systematic review to see what the literature is saying, a pilot study of an online peer support program that really became about talking to the peers themselves and their experience in running peer support, and then also staff on the ground who are running programs as well, because ultimately I know that the lived experience of staff who run these programs is not represented in the literature fully. So firstly, I'm trying to kind of define what this thing is a little bit, so we can have more rich conversations about how to share good practice and understand what's working and what's not, because ultimately there's so many different types that it's hard to have a shared conversation. And the last thing we're doing is trying to understand what university students actually understand peer support to be and what factors influence if they're accessing it. So I'm going to talk you briefly through these 4 studies, kind of what the research questions are, and also some of the findings that I have initially of a few of the studies. So firstly, the systematic review that I have been working on. I haven't done a systematic review before. I've only done a literature review. If you've ever done a systematic review, my goodness, it is a long process. But really, we're trying to understand how university peer support programs affect student mental health and well-being according to the literature that's out there. So I haven't got to the piece of going through the gray literature yet. I know there's a lot of stuff that is not published in journal articles. I have a lot of reports that I found, and I kind of have a long list of gray literature that's not included in this, but I'm working on that. So I went through 5 different databases, and ultimately I sifted through around 13,000 papers. The reason I had to go through so many papers is that there has been a systematic review done looking at kind of university peer support for student mental health, like what is in the literature. And that's great. I thought, okay, that's done. Well, then I looked more closely at it, and ultimately they had only used the term peer support. And peer support is one term that's used, but actually things like peer mentoring, peer assisted learning, peer social support, all of these are also relevant types of peer support if we're talking about university students being trained to support each other based on their lived experience of being a university student. And that's kind of how we roughly are defining a peer in a university setting. So I had to go way wider than that systematic review is doing, and because they, I think, only got about 4 papers, whereas I sifted through these 13,000 papers, loads of fun, and got to about 30 actual papers, and they are really wide in the types of peer support that they represent. So if you want more information on that process, let me know. So this is the area that I was really kind of hoping to get to with the systematic review, is like, what's actually happening when it comes to peer support? What are the types of peer support that are going on? And are there, like, can we categorize them really? So out of the 30 papers, I was able to put them into 3 different categories. So firstly, this peer learning category, there's only about 3 papers in that, but that was this peer support that convenes students based on academic objectives. So there's these 3 papers using different terms for this different type of peer support: cooperative learning, peer assisted learning, peer-led team learning. And the terms peer and learning were used most, so I've kind of named it loosely peer learning. Then we have this peer-led support group, which was, I guess, the most popular out of the papers, and that's the most common category. And this type kind of aims to gather groups of students together for mutual support. Terms like social support group, peer-led, peer leader groups, support groups were really common, but we've kind of gone with the peer-led support group because these were the terms that were used most often in all of these types of support. So this is essentially a group space where there's mutual support. And then we have the peer mentoring programs, which tend to be for incoming students being paired or in a small group with higher year students. And that was also a very popular one in the literature. I was also interested to see kind of how they were structured, because obviously there's quite a lot of group spaces, but there were also one-to-one spaces. All of them were the peer mentoring programs, or there's a mix where there's a one-to-one and there's some like homework that you do. And really an area of interest that I actually hadn't come across at all was where everyone is trained in the same way and they participate together and it's totally mutual, which I thought was really interesting. I saw that in the peer-led support groups, I think, as well as in one of the peer learning groups too. So these are the categories that I found in the literature, and I'd be interested just to hear if anyone has a different category. So what type of peer support is most common at your university? So you can just choose one of those categories. And if there's a category missing, let me know. This is just a little sense check with those of you who are here to say, you know, has the literature missed something? Because I know practically that it potentially has. Peer education, for example, really wasn't that represented in the literature. But yeah, do let me know what you think here. You can just submit a response. Yeah, and I think that would be quite helpful. But yeah, so I think peer education is probably the piece that's missing from my experience, but if you have any others, we'll have you share them. That would be great. Let's see, can we see the results, Chiquetta?
People are still responding.
Oh, okay, great. I'll give you a second. So have a little think if there's any categories that's missing.
Okay, I'm going to end the poll now.
Cool, thanks, Chiquetta. Okay, so there's a few people who said there's a category missing. So I would love to know what that category is. So if we could just pull up the next question. So there's 17%. So it looks like the peer mentoring is the most popular with the peer-led support group. So that's interesting because that's also like in the papers that those were the most common as well. I think a lot of the peer learning spaces, we're going to ask you to share what category is missing, by the way. So I think there'll be another pop-up for you. A lot of the peer learning spaces, because the objective is an academic objective, many times it might be that there isn't a consideration for how that could be improving mental health and well-being. So if there is an evaluation of it, a lot of times the evaluation is connected with retention or academic outcomes. Whereas I suppose, like I hope in the systematic review, we can share that actually peer learning can have an impact on student mental health and well-being, those peer learning spaces. And so maybe there's an opportunity there really to measure that and kind of demonstrate that. And I think that's where they, you know, thinking about the curriculum is important, that education for mental health toolkit, and thinking peer support is actually something that I think is going to be sort of featured in that as well. And like these peer tutor programs. That was my comment on the education for mental health toolkit. I was like, where does the peer tutoring and peer assisted learning, where does that fit in? And they're like, yeah, that's a good point. anyways, yeah, so if you could submit and let me know what is missing, because we had 11% say there was a missing category. I'd be very interested to know what the missing categories are. Maybe it's peer education, but yeah, it's good to do a little sense checking. I know from working on the ground that it's not fully represented, and actually the peer assisted learning and the supplemental instruction kind of out of Europe, that model of peer support is really quite common. But sorry, Jaquetta, did we see results? I didn't see anything.
No, I don't see let's see if I can change that.
That's fine. Otherwise, you can just put it in.
Okay, so the two responses were peer counseling and then peer advocacy for changes in practices and policies that will promote well-being.
Yeah, that's great. Yeah, there's a really interesting paper that's come out of the States around peer counseling and students' impressions of that. And yeah, it's really interesting that actually didn't come out of the systematic review, because I know, and that's a really good one to note, is I think those are missing. There's something missing there. But ultimately, I think that those might come out of my the gray literature search. I think that I have some papers around those. So this is definitely not exhaustive at the time, but this is about published articles, I suppose. And peer education, so that the peers are guiding to healthy coping mechanisms. Yeah, definitely. I think there's a lot of peer education programs in the States, peer health education programs as a kind of health promotion as well. So I do think that's missing in the literature, but hopefully it comes out of the gray literature search. But thanks so much for doing that little sense check with me. I want to talk a little bit about who these peers are, because defining what a peer means, I think, is really, well, it's a big challenge, actually, because saying that a university student is a peer with another university student simply because they go to the same university, I don't think it's quite enough to define that. And so what's happening in the literature is that most of these programs are saying that you're a peer because you're in the same course, and a lot of these programs are course-based, and that the person who's in the peer support role or the peer facilitator is been kind of chosen based on their seniority, and that they're higher year students. Not that many by lived experience. So I've been hanging out with Foundry, the youth mental health clinic and organization, and they're incredible. They do some really amazing work, and youth peer support work is part of their kind of core, and they bring people on based on their lived or living experience as peers. And I think that in university settings, there's a lot more apprehension with that, with kind of like liability and risk. And students, I know the models that I've run, we don't necessarily encourage students to share about their lived experience. They're kind of there for altruistic wants, and because it's almost safer for them not to share things, they just use active listening and signposting, and that can be really helpful. But I think there could be something around sharing this lived experience, because how is it different than counseling services at that point? Because we're not really trying to replicate it, we're trying to offer something that's different. So it's making me think, but I won't go into all of my meanderings of thoughts. But the other area is, who is peer support for? And not surprisingly, it kind of is aligned with those peer facilitators. So a lot of these are based in courses, a lot of them are based on the year, many of them are first year students. We know that that's a real pinch point for students to kind of come in and build that sense of belonging. A lot of those peer mentoring programs are there. So ultimately, a lot of these in the literature are based on courses and by year. And this is another missing thing, because actually, practically speaking, I know many peer support programs are being offered centrally, not through a department or a course. So once again, I'm seeing, and this is why this other study that I'm working on is really important to understand the practicalities of actually running these programs. So these are the top mental health and wellbeing outcomes that were measured. They're all over the map. So this is why I've had to do a narrative analysis, not a meta-analysis for this systematic review, because very few of the measures were shared. So anxiety, stress, and well-being are kind of the major outcomes that were measured, but what measures they use is all over the map. The GAD-7, STAI, those were really common. Perceived stress scale, those were most common, but anxiety and stress are really the ones that have been measured most in this. So I don't know, it makes it tricky in this world, sharing conversations when everyone's measuring different things, but I guess we can see that there. And then ultimately, it's a real mix of if it makes a difference. So there's some significant differences for anxiety, for stress, mostly. But then there's also studies that didn't really show any significant results for anxiety or stress. So I think it's a real mixed results of what we're seeing in the literature with peer support as an intervention improving mental health and well-being. And so I think it means that the conversation needs to be a little bit more balanced. I suppose there's some colleagues who really feel like this is the way forward. But ultimately, I think understanding the different types, this is where I'll get into more with my analysis, is which types exactly are making the biggest difference is kind of where I want to go to with this. But that's the really brief outline of some initial findings that I have for the systematic review. And I'm going to be now getting into more of this analysis and then writing up a paper. But the second study that I was looking at was if online peer support can improve student mental health and well-being. We were looking at what are peer support facilitators' expectations, experiences, and lessons learned from transitioning in-person peer support groups online. We had hoped to do some evaluation of the attendees who came to the online peer support group that was for general well-being, but there weren't enough students who came. So it became more about what are the facilitators' experiences from running these online. And I won't go into this in too much detail, but ultimately, students who run these programs, they are trained to run these programs. I did a focus group with them before they ran the online peer support group, and then they had a top-up training beyond their other training that they've had as facilitators of peer support with student minds, kind of how to run an online space. They ran the program. It was a 3-week program for general well-being as a peer support group. And then I did a focus group with them afterwards. And their major concern was attendance and engagement. Before they started, they were also worried about how they build a trusting sort of safe space online. And ultimately at the end, they felt that they were able to create a really warm environment is the term that they used, and that actually it worked quite well, they felt, and that it felt really safe, and they felt like they knew everything they needed to do in that space, which was reassuring. But ultimately they didn't have enough engagement for us to say whether students themselves think it's helpful. When I tried to ask them which would you choose, online or in person, because these facilitators had run peer support groups in person before, they were like both. Classic, that'll problem, right? So, but it does bring up a question about engagement. And I think ultimately they feel like it's a more accessible option for students who are on placement, maybe not on their university campus. For them, it felt like a good option for students, but the engagement piece is the real one that I'm going to talk about in further detail. But yeah, getting people to turn up was the real concern. So those are some initial findings for that from a facilitator perspective. And I'm just going to talk you through the research questions for these last 2 studies, because even though I have the data, I don't have any initial findings yet. So the last study that was kind of looking at what is peer support, what is the current landscape, I'm trying to understand what are the approaches, challenges, and lessons learned of running peer support for university mental health and well-being from the staff perspective. So I did 15 interviews with colleagues from 14 different institutions across the UK and all parts of the UK from lots of different institutions, thought a lot about the types of institutions we were talking to. And they have such a variety of peer support programs. The peer education piece isn't so common in the UK. I know it's more common in the United States. So I wouldn't say that's fully represented. And same with peer counseling, actually. It's not, that term isn't used as much in the UK in peer support spaces. But my systematic review was international, so it's interesting that that's all come up. But I was conversations to understand what this looks like, what are the challenges, what's going well. So I'll be excited to share that from a practical perspective. And the last piece and kind of the main barrier of why I haven't been able to do an efficacy study is that not enough students are coming to these group sessions. So Student Minds would train up students in universities to run group peer support in their university, and Student Minds would offer central supervision for students. But year on year, they've been seeing the engagement decreasing in these group spaces. And so it's made us really think, well, what do university students actually understand this to be, and what factors influence if they access it? Because I think that maybe we have some assumptions as staff. We're like, okay, students turn to each other for support naturally. So let's just like structure that, formalize it, make it safe, and that's going to be able to help loads of students. Like on paper, that makes sense, but ultimately it comes back to the question of, well, who is a peer for a student? And actually, is that service just totally replicating a counseling service? Does it look different? What's the different offering? These are kind of the big questions that I'm asking. But we did focus groups across the country in the UK with lots of different institutions and talking to students about, well, where do you see peer support fitting in? Where does this fit in? So we gave kind of student stories, and then they chose which support services were most helpful, and peer support was one of the ones listed. So it's really helping us to understand how students naturally define peer support without being kind of spurred on towards it, and where they see it fitting in as a support service. It's been so interesting. We did 9 different focus groups across the country at 7 different institutions. And so I'm really looking forward to sifting through all of that qualitative data. But yeah, some kind of final thoughts is the defining piece is tricky. And this is a conversation I've been having with lots of colleagues in this overseas institutional visit. And it makes sharing good practice really challenging, because if you're talking about peer mentoring, not talking about peer counseling, those are a little bit different. The training that you've had is different. The goals of it are different. So, and I think that was my hunch before, is that I don't think students really get this, but doing the focus groups has really like clarified that. Like students are literally, remember one of the focus groups having a conversation. Well, what do they mean by peer support? What is that? Is that like a university thing? Is that like a student thing? Like they were saying out loud all the things that I thought they were thinking. So yeah, it's a little bit unclear for students. And I think there is some potential definitely to improve student mental health and well-being according to the literature, but it's mixed, and different versions I think might be required in the student journey ultimately to kind of integrate into the academic experience, think about how it's embedded into the curriculum. That's the type of thing that I'm on. So it's normalized, and it's something that is part of the student experience from the start instead of a thing that you go to as an add-on. Those are some thoughts I'm having, and really integrating it into the academic experience could be something that's maybe the most accessible. There's a little quote from one of the participants who is a peer support facilitator. And my hope is that gives students that are feeling lost right now a sense of connection with other students and get some support. No, that's not them just feeling like this. I think it's a time when students really need it. And that was them talking about why they thought peer support was so helpful and what they were hoping to get out of that online space. So yeah, that's where I am at the moment with this research. It's become more about defining it and understanding students' definition and understanding the barriers that they have. So I'd love to have a little conversation and ask any questions that you might have. Please send them on through.
Great. Well, thank you so much, Julia. That was wonderful. And I actually hadn't thought about peer support in quite such a complex way. And so that really opened my eyes to a whole lot of complexity and lack of definition and varieties, and helped me think about what we're doing as well. So thank you for that. So I do encourage people to type their comments and questions in the chat box. We welcome them. Perhaps in the meantime, I might just share something that we've been doing research, with a student in the area of men's mental health promotion. And one of the things that we've found is that as soon as you mention mental health to men, typically it's like, I don't need that. I'm not that bad. I've got stress in my life, but I'm not that bad.
Yeah.
And so it does seem like the words that we use describe our services or the opportunities for mental health promotion are barriers to particular groups. And in this case, it was men. And so, yet they were much more receptive to this idea of talking about things like mental fitness and, even stress and that, if it was really embedded in everyday activities and fun activities. And for them, that might be like sports and physical activity programs, and inserting this within those programs was seen as a lot more acceptable, because there's so much stigma around needing support, needing mental health, that they didn't really want to go in that direction. So I guess I'm wondering if that ever came up in your conversations about the language we use to define these services, because even support might put people off a little bit.
Yeah, I mean, that's become such a major focus of this project, is like the language we use talking about it as like staff at universities, like, okay, let's clarify what we're talking about. And also for students, I agree, like the peer support groups, practically speaking, I know from experience, tend to attract white women. And both as peer supporters and as well as those attending the groups. So yeah, I mean, the language that we use does make a difference. And I think the kind of transcribing some of the focus groups where we are talking about where students see this fitting in, hearing them try to grapple with what peer support is made me think, I think we need to just use some different language here altogether. And I'm kind of starting to feel like, well, actually a peer support group, the real benefit and that you get from that is this connection, right? Like maybe we should just move towards like connect with each other. Like, you know, here's a space to like, I think it's making me think from a practical service side, like what words I use, because I don't think peer support's landing right. So yeah, I'm hoping that comes out of the focus groups is maybe some recommendations for it. But I think what's definitely become clear is that it's not clear for students. And then when you see support, I think it is attracting a certain student. And one question that we used in the focus groups was like, who do you think is accessing this group support once we define it for them? And they're like, oh, well, it's probably somebody who's quite outgoing, quite confident, quite extroverted. And I'm thinking to myself, is that really who we're trying to support? Not really. Like they probably have gotten, you know what, like it's really made me think about it. You've asked a loaded question, Joan.
Yeah. You know, and I think in some ways the campus, we have campus groups, like, I don't know, Melissa, you know all the groups we have on campus, the student groups for various activities, whether it be sports or, I don't know, dancing or whatever. And I think in some ways they have a way of bringing students who are interested with similar interests together to make those connections, but they do it over the type of interest they have, as opposed to calling it support.
Yep.
And people, I think, continue with those groups because they're all interested in the same thing, this hobby or this activity or whatever it might be. And I think those groups do provide those connections that people are looking for. And you don't have to be in need of support to sign up for a group. You just have to be interested in whatever the group is offering.
Exactly. And that's why at King's we train student leaders who are well-being leads in different societies and sport clubs to kind of do well-being activities in their community, as well as have some basic active listening and signposting skills, because it's like those students know their community. They know what that group needs and they're embedded in it, instead of trying to create this extra support service. And obviously the engagement there is different. It's better, right? But it's a both and, I suppose. Yeah.
You've got a lovely comment in the chat. I think you can see that.
Hi, Juliet. I have the best supervisors. Sorry, they did not ask me to say that, but they're literally the best. Great supervisory team. Yeah, any other questions at all? I'd say if you want to connect, please do reach out on LinkedIn, or if you're on Twitter, connect with me there. I clearly love chatting about peer support. So if you want to talk about it or think through some things that you're kind of facing in your institution specifically, I'd be really happy to have a conversation. It's great to connect with people who are interested in supporting students to support each other.
Melissa, do you have a comment or question? No? Oh yeah, so we have a comment from Wilna.
my old King's crew's here.
Oh, there they are.
I got a King's cheerleading team. Yes.
Lucky to have her at King's. Yes, you are, absolutely. This is wonderful. I mean, the other thing that we've been involving students in at UBC Okanagan is, looking at some of the practices and policies that create stress for students, and I mean, exams is one of them, right?
Yeah.
And there's one department on our campus where students refer to it as Hell Week, which is this week of midterm exams, because they're just like boom, 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 one after another. So it's like, okay, so why do they have to be that way?
Yeah.
Right. And so we began to sort of work with students and use student voices to expose that as a way to begin to shift practices that actually are creating extra stress and anxiety for students. And it could be simple if you call it simple, like the scheduling of exams, the scheduling of final exams, all of those sorts of things. How long students have to withdraw from a class without getting like a big F or W or whatever on the transcripts and all of that sort of thing. Those are practices that we need to also be thinking about that influence student well-being.
100%. I think that's why I really appreciate the pyramid model of support. Is like the curriculum is the basic part of something that's having an impact. And I think that the pedagogy of curriculum plays a major part. And that Education for Mental Health Toolkit, I will send the link. So I'm assuming there will be a follow-up email to all participants. Professor Juliet Foster, one of my supervisors, is one of the authors on it. It's a really helpful resource and thinking about when exams are. And also talking to students, it seems so basic, but I know Melissa's team is like such a champion for this, but if you're a professor of some course, you're not thinking about how all these other courses are happening at the same time and impacting things. You can live in a little bit of a tunnel. So I think, including students in that conversation is so incredible. And I think Melissa's team's work on that is really impressive.
Yeah, exactly. Well, this has been really great. And lots of interest, as you can see from the chat. And so I do want to just take a moment to thank you very much for sharing your preliminary research with us. Very impressive. And of course, we'll need to have you back to tell us about the results of each of these phases, because all of them look fascinating in and of themselves. So I'm really looking forward to reading and hearing about the results of your research. So all the best with it and the rest of your trip. And thank you very much for this presentation and taking time to share this with us today. Thank you. Again.
Thank you so much for hosting me and everyone who came, even from Kings. Thank you so much.
Yes, thanks to the Kings people for joining me.
Bringing us together. I love it.
Yeah, that is great. We'll have to do this more often.
Yeah, definitely.
Thanks again. Goodbye, everybody. Thanks for joining us today.
Thanks very much, Joan and Jaquetta. Bye-bye.
Bye-bye.
Thank you.